When the doctors did the C-section and saw the baby, they couldn't believe their eyes. The baby born with 2 heads is lucky to be alive after the operation to amputate the 2.2-pound mass protruding from his skull that contained part of his brain. The condition arises when the baby's skull does not close properly in the womb. Abdul Latif was left with a mass of 2.2 pounds, 1 kilogram, which looked like a second head. Surgeons were forced to operate on him when he was only 3 days old. A Syrian baby born with 2 heads is fortunate to have survived a successful second head amputation. Abdel Latif Chukruk was born with part of his brain sticking out of his head, but he escaped death after a risky operation to close the hatch. He was diagnosed with ischemic hydrocele, which is estimated to affect about 1 in 12,000 babies in the womb. The condition arises when a baby's skull does not close properly, causing the brain and the membranes covering it to protrude through an opening in the skull. Abdul Latif was left with a massive 2.2 pounds, 1 kilogram, mass, and appeared to have a second head. Surgeons were forced to operate on him when he was just 3 days old, but a complex operation to push his brain back has proven successful. Abdul Latif's mother, Sanaa Halil, from Aleppo, decided to cross the Turkish border to give birth to her 7th child by caesarean section. Facing an almost certain death, Abdel Latif was taken to the Iskenderun Developmental Hospital on the Mediterranean coast. Surgeons were forced to operate on him when he was just 3 days old, but the complex operation to push his brain back has proven successful. What is encephalocele? Encephalocele is a rare birth defect in which the structure that makes up the brain and spinal cord is flexed and closed. This causes a bag-like protection of the brain and the membranes covering it through an opening in the skull. It affects about 1 in every 12,200 babies born in the United States each year. Its prevalence in the UK is unknown. The exact cause of encephalocele is not clear, but it may be a combination of genetic and environmental factors, such as vitamin D and folic acid deficiency during pregnancy. Treatment includes surgery to put the protruding brain back into the skull and close the opening. The patient may suffer from persistent complications. Their brain, neurosurgeon, and spine specialists put the prominent brain back into his skull and closed the opening. Dr. Mehmet Kobaran, who performed the surgery, claims that a case of severe encephalocele can often be fatal. He said, "A brain hydrocele is seen in 1 out of every 5,000 live births. Grades 3 and 4 are less common, and are more often fatal." Doctors diagnosed Abd al-Latif as having a 3rd-degree ischemic hydrocele, which is sometimes known medically as cranial cleft. The process took 3 hours but was fraught with difficulties. Of course, it was complicated by the brain tissue, said Dr. Kobaran. Wrong surgical intervention may cause the death of the patient due to respiratory failure and hydrocephalus, which is the accumulation of fluid in his brain. After the surgery, Abdel Latif was placed in intensive care, and after 8 hours of observation, he was allowed to breathe on his own. Dr. Kobaran said that Abdul Latif has recently been released and is expected to enjoy a normal life.